All right, good morning, gang. We're live. It is exactly 9 o'clock, 61 degrees, and a morning much like yesterday. The fog is lifting. We got a Tuesday in progress, and with me in the studio here on Aired Out are two very important folks in our community who are making amazing strides to, take care of addiction, or at least fight the good fight against it. We have Dr. Mark Deppman and also Eva Zaret from the once called Washington County Substance Abuse Regional Partnership. Did I get all that right?
You did.
Man, that is a mouthful. Welcome both of you. I'm so glad you're in here, and I want to start out by saying thanks to Raylene for learning about you guys and the Central Vermont Prevention Coalition, which is the new name of this program. Doctor, you're the program director, I think.
That's right.
And also an ER doctor.
That's right.
At Central Vermont Medical Center.
Exactly.
Where do we begin with both of you? First off, Eva, congratulations. Welcome back. Is it back to Vermont or just to Vermont?
Back to Vermont, yes. It feels good to be back.
I'm sure. It is wonderful to have you on board. This is, we're talking about, is it $1 million, a grant that has come into the state of Vermont?
Yes, that's right. We actually just finished our first year. So it's $1 million spread out over 3 years. And it sounds like so much. And then it's, not as much as it seems like.
Right.
But yes, it's an incredible amount of money to implement some really important initiatives for the next 2 years now.
In chatting with Raylene over the last couple of weeks, and in her description of the new Central Vermont Prevention Coalition, I said, okay, so this. And she said, no, bigger. Okay, so then this. No, even bigger. You guys are a massive umbrella that is over the state of Vermont. This is huge.
No, it's actually a regional coalition. So it's a Central Vermont coalition.
Okay.
And the grant funding that we have for this 3 years is part of a tranche of money that came from the federal government to support the fight against the opioid crisis. And we were awarded, Central Vermont Medical Center actually was awarded the $1 million to use to augment and fine-tune the work of this coalition as a sponsoring agency, as a sponsoring organization for the hospital.
How did you get involved with this, Doctor?
Great story. And by the way, I just want to say it's amazing being in downtown Barrie doing this.
Yeah.
My perch tends to be in the ER at the hospital.
Yeah.
And, we're up on the top of a hill and we receive things by ambulance and people come in by car with their urgencies and crises. And every one of them is a in emergency medicine, everything is in some way a crisis for that person and that family.
Yeah.
And we're not in the street. I mean, I don't live the life in the street. And so much happens in the streets of our towns and our cities that is really important. And a lot of, life and death and important life decisions get made. And you see these things happen in the street. And our EMTs, our ambulance crews see these things happen. The police get involved. But more than anything, people's lives are touched by this issue of substance use, addiction. Particularly, we always think we're talking about just opioids and drugs. Alcohol is a big part of a fabric that can tear people's lives apart, and we want to keep an eye on that. But back to my point, up at the hospital, I've been at CVMC since 2007, and in all humility, I have to say that I'm not going to say the rest of my colleagues are the same, but I think the ethos back in medicine 10 years ago or so was that if you had a problem with alcohol or drugs, you had to have your own agency to figure out. You had to have the willpower to get better and go find your path. And here's a sheet of paper with the name of some organizations that we don't even know what they are, but they've been given to us, and you need to leave. We're going to discharge you, and you need to make these phone calls yourself.
It's up to you.
And that spirit was so wrongheaded and was shown to be just perpetuating the crisis. And I think my department 10 years ago just woke up and said, we've got to do something different. The doctors, the nurses, the staff just said, we've got to do this differently. And we looked around and found that there were partners in the community that were working on all this, and we just didn't know one another. They didn't know the hospital. We didn't know them. And there was this amazing confluence back in around 2013 where the state, to its enormous credit, was developing the hub and spoke model for opioid treatment. And that hub and spoke model meant that in every region of the state, there was going to be an addiction medicine specialty clinic that would lead the medical treatment and the surrounding therapeutic treatments for people that were struggling with opioid addiction. So they would start using medication-assisted treatment with things like Suboxone or methadone, and then try to get those folks into stable lives, integrating into their medical health.
Exactly.
And that was all happening around 2013, around the same time that our department said, we got to do something different. We got to get to know these community partners,
sure.
And we need to start screening every single patient that comes through our department for their use of alcohol and drugs and cigarettes. And that happened. And we then moved to create this coalition where we all got to know each other and work together. And that's led to so many interesting, great relationships, productive relationships, and exciting programs that led inevitably to these grants that we've received.
Can you list off both? And there's no rules here, so you can cut each other off. You can interrupt me, but can you list off some of those programs that you're now partnering up with?
Go ahead, Eva.
Well,
talk about some of the partners in our coalition.
The one I would mention first, just because he's been on the show somewhat recently, is Bob Purvis at the Turning Point Center. We work of Central Vermont. There's turning points around the state, but of Central Vermont here in Barrie is a very close partner. That's our sort of recovery specific partner. We have a partner in Central Vermont New Directions, which does primary prevention, especially with youth. Of course, all of our treatment partners with CVMC and Treatment Associates and the Hub, the CVM BART Clinic, Vermont Cares, which is a harm reduction agency.
Yes.
Mm-hmm. They're statewide, but they have a real presence here and are helping people stay alive every day. But then we also, so those are kind of like the primary players in this work, right? Like
Sure.
They're sort of the ones that make sense to people.
Yeah.
But then what's so amazing about this coalition is that they realize that it is a system problem and it's so much more than that. And so there's also representation from the community justice centers for community reentry, law enforcement is at the table, youth services, housing, intimate partner violence, and the state is obviously there, the Department of Health.
Washington County Mental Health too, right?
Washington County Mental
Huge
Health,
partners.
huge. Mm-hmm.
Yeah.
So the list goes on and on.
I was chatting with our deputy chief, Joe Waldsworth, last night, and he is just so honored and excited to be partnered up with you guys as well.
Yeah, Joe's getting involved in a project that we're just kicking off now with Chief Brian Pete in Montpelier, and hoping to involve it will involve the Barrie Police and eventually really the whole county, and that is developing a really mature 24/7 crisis response team that's embedded in the community, uses community resources, de-emphasizing policing, and focusing more on agencies and partners that can actually help someone at the time of crisis and get them to where they need to be. That whole sense of 24/7 responsiveness and knowing where to turn and having someone respond to you is really crucial to our mission, because
we can't be wasting time sitting around and figure out where to go.
And everybody in this community, everybody, whether you live in Barrie Town or Northfield or Williamstown, we just want everyone to know that this county is full of really outstanding resources. They're here, they're poised, ready to help. They're deep, they have openings, there's no waiting list, but people need to get through their minds that they want to help others, that there is no stigma, that there's nothing wrong with this. This is a medical condition like diabetes or high blood pressure, and you want to prevent someone from having a stroke or a heart attack. Here you want to prevent them from dying, and you want to get them back into a healthy stream of life with your community. So if you can get that message, we just want you to know that the resources are there and how you can access them 24/7 and hear a voice that's going to be helpful and not one that's going to be threatening and potentially even re-traumatizing a little bit. Because in addiction, a lot of people, there's a lot of trauma behind addiction. And what you want to do is make sure the entry path to recovery is one that is as smooth and bump-free as possible.
Yeah.
And so you build a response team that is going to meet you where you are.
And has to get your husband or your wife or your family members involved in a neutral way. Without you mentioned stigmas, and they're huge, as you both know. They're massive, and there's so much of that in our society today. I mean, it's just incredible. I noticed that prevention is one of the staples that you guys really hang your hat on. That's kind of funky in that we don't know that we've got a problem until we have a problem, and especially with a pandemic that's upon us, and isolation, and all of the things that go with that. I have read, as I'm sure you both have, that alcohol consumption over the last year and a half or so has just spiked across the world.
Yeah.
Not America, the world.
Yeah.
And with that, alcohol is can be such an effective conduit to get into other drugs. As we both have had guests on the show that have started with alcohol, and it's very easy to have that morph into something greater with illegal drugs.
Yeah, there's no question that the pandemic has been an enormous stressor and has upped the rates of alcohol use, alcohol initiation, as well as drugs. And our coalition is wide awake about that and looking at ways to respond and deal with that. But I want to get back to your point about prevention. Primary prevention really is about preventing initiation of use from the very beginning. And that's about youth and community. To me, it's about youth and communities. It's about really raising communities where the participants in the community, the parents, the schools, the business owners, every single citizen wants to create a healthy community where young people have alternatives to experimenting with drugs and alcohol. History is, there's a millennium of ways to make yourself feel a little better when you're stressed.
Yeah.
And we all do it. We all use caffeine.
Sure.
There's lots of things we do to make ourselves feel better when
Right.
we're stressed and to help us perform better. And, things of, coca was used in cultures to keep people more productive. I mean, you have to wake up to the fact that none of this is new. But what is harmful use? Are there better alternatives to some of these things? What has science shown to be harmful about tobacco is a great example. I mean, once
Sure.
it became clear how truly harmful tobacco was to the health of your lungs, the engagement dropped way, 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 way down.
Right.
And we're still fighting that battle, but the usages of tobacco are incredibly low compared to where they were 50 years ago.
Sure.
And
Isn't
that's
it amazing how back in the 80s how different life was for you and I? We're all, you're way younger than us, but you know what I'm saying.
Yeah, but in the
It's a different
1960s,
world,
when
man.
the Surgeon General came out and said, this causes cancer, people paid attention and believed the science.
Yeah.
And we need to keep that culture going. But back to community engagements. If we could get communities to say, we want our kids to be busy and be engaged and be working and be engaged in after-school activities and sports and clubs and exploring how you program and create better podcasts for your youth. There's all sorts of things people can be doing, but we've lived in the last 20 years where school budgets have been gutted and after-school programs have been gutted and music programs and art classes have all been gutted.
Bingo.
And, you can't, people want better, they want their soccer fields to have nets that hold the balls. I mean, we've got to decide as a culture that our youth are really important, and that's everybody. Everyone's involved in that. And that's part of the primary prevention that we see as so crucial, and that they're exploring other parts of the world. I mean, there's this model in Iceland where they've made. I mean, Iceland's an island. It's a different world. Maybe it's a little bit like Vermont, but it's a nation that made a commitment to strengthening their communities to reduce their substance use among youth, and they did it in exactly this way by getting parents and schools and communities to set expectations, to provide other activities, to develop spirits of engagement, and they did it. And those social scientists are now on the payroll in places like Idaho and West Virginia trying to do those things there.
Sure.
I mean, I think Vermont can look at that and say, how can we? I mean, Vermont's the kind of state where this is natural. And even in a society that's fractured by political differences, I mean, we can come together around healthy youth.
Please.
And we'd like to be part of helping that happen, and that's part of our primary prevention dream here.
Isn't it amazing how we come across folks just up at the nursing home up here, just chatting with folks who are in their 80s or 90s, to explain to them, or for them to see on television, that there's heroin in Vermont. There's cocaine in this beautiful little state with all of its beauty and its mountains and beautiful environment, and these little New England small towns that we have a drug problem in Vermont. I mean, we have a drug problem in most states, but is it getting out of control, Doctor? Do you think? Is it getting worse?
Well, it's definitely getting worse, and certainly the COVID epidemic has had a role in that. We live in a funny culture where, Vermont's like most states now. Every town has its own little brewery, and they're important engines of the economy in the state. Cannabis is going to be regulated soon in this state, and will be another engine of enterprise in this state. And it's all about balancing the message and balancing the information, and having that information taken up by responsible citizens who want to see their communities be healthy in the midst of that. But it's a tough, there's opposing interests there, and you have to find that balance and come together as a community and say, we're going to look for the balance. And, the hard drugs are way outside of any part of this. I mean, that stuff's just got to go.
Yeah.
And that's, driven by forces outside of our state that are pushing these things into here, delivering them from all over the world. Mm-hmm. The internet is, the black markets now. The black web is now opening up other ways to get drugs. It's a whole nother problem.
And the price of the market for heroin is just cheap.
Yeah. And the fentanyl is just really a toxic mix into it.
Building Safe Harbor in Central Vermont is the name of this program, this grant program. Mm-hmm. For the folks that are watching right now, that are saying, "Okay, this sounds fantastic," but where do we go? What's the hub? What's the one website where we go to learn about this grant and to see the progress that's going to be made? Exactly what you're going to be doing, engaging with the community. Mm-hmm. Where do we go?
Well, we have a website. It's cvprevention.org. And all of this, our coalition has been around for several years, but we're just sort of getting on the web. So these things are are sort of in their infancy. But that's a good website, and people can always reach out to us on our new social media, Central Vermont Prevention Coalition on Facebook and at CV Prevention on Instagram, or they can email me as well, eva.cvpc@gmail. But you had a guest on here recently, and he was explaining his life story from beginning to now, Wayne. And there were so many pieces of his story that I was listening to that struck me, because they were things that we're working on right now as a coalition and building a system around. And the first was the primary prevention piece that Mark just talked about. So he started using alcohol in high school, and the question is, what could we have done to help a kid like that, not start using at 17, 18 years old?
It's the catch net to get them before it starts.
But get it before it starts. And that's public health at its core.
Understanding that most adolescents and youth are going to try these things. Because that's what you do when you're,
of course.
when you're experimenting with life.
I don't know if it's right to set the norm that most kids are going to do this, because I don't know that that's necessarily true.
Right. It's probably
I don't know
most.
that it's necessarily true. The second thing that really stood out to me about his story was he went through this really tragic experience of losing his grandfather. It set off a depression, a mental health, crisis for him.
That's right.
And he started drinking alcohol to help with his feelings that he was having and this deep depression that he sank into.
Yep.
We know from the data, and I'm a huge data nerd, and everything needs to be about the data. Every 2 years, there's a survey done in high schools about risky behaviors that kids partake in. We know that high school students who felt sad or hopeless for 2 weeks in a row in the past year are way more likely to have reported using a substance in the past 30 days.
Sure.
So the mental health piece is so important. And one of the things that we are really hoping to do, like Mark said, is to get into schools, not just for the primary prevention piece, but to train school staff on how to maybe recognize the signs that a kid is struggling. Maybe it's a coach. It doesn't have to be a teacher. It could be somebody.
Maybe it's social media.
Yeah, maybe there's a way that we can reach them that's sort of untraditional. It's not just parent-teacher organizations, but how do we get to kids who are struggling with mental health, which we know has been an issue for kids during the pandemic, because we know that they're more likely to use substances.
Yeah, sure.
The third piece, and we can unpack all of this, but the third piece is that there was a time, and this goes to your safe harbor question, when he came out of the hospital before he went to treatment.
That's right.
There were a few days.
That's right.
That he was so fortunate to have his sister who was able to take him in, because he said he knew that if he went back to Winooski, he would start using again.
Absolutely.
And this is a huge effort that we're trying to undertake of building Safe Harbor, building a crisis stabilization place that people can go to for those few days in exactly that situation.
Right.
And that doesn't exist here.
Yeah, I don't know if you know this, but no one has this kind of safe harbor respite space in Vermont unless you live in Chittenden County and you can access the Act One Bridge program that is in Burlington.
Did not know that.
So that's a program that is linked to the public inebriant bed, but it also offers short-term stabilization for anybody in crisis around drugs or alcohol.
Yeah.
And it's an entry point to treatment, it's an entry point to stabilization, it's an entry point to connections to services.
Sure.
But it's a place where you can go.
Right.
That does not exist really in a programmatic way anywhere else in Vermont. And I'm a great proponent that there need to be around 8 of them around the state. And that's the safe harbor that we put in our grant. Because to us it's a big gap. I mean,
sure.
so many of our coalition partners are just filling in all the pieces around primary prevention, reducing overdose deaths, and reducing diseases associated with drug use, such as hepatitis C and HIV. And the hub and spoke model is alert and vibrant and active and has openings, and the recovery resources we have are fantastic. And there's a whole workforce of recovery coaches being trained through Bob Purvis's shop. That's just really exciting.
Sure.
But what we don't have is when that moment when someone needs to be pulled out of, who voluntarily says, I just need to be out of my environment for a couple of days so I can chill out.
Like Wayne kept saying, the people, places, and things that you need to remove yourself from that are going to be a problem for you.
Right.
But isn't it amazing?
Resources wrap around me.
Yeah.
We don't have that place here.
Isn't it amazing, though, that like Wayne said, you're the only one that can really, truly have your hands on the wheel to remove yourself from that.
Mm-hmm.
But if you don't have a sister that's going to take you in,
bingo.
That's the problem.
True.
If you don't. There may be, what we like to think is that there's a recovery coach who's at least connecting with you while you're at risk and kind of talking to you and being available to you constantly. But if you truly have no place, if you're homeless or there's no place that's safe,
yes,
it's a crapshoot as to how you're going to do.
Sure. I've chatted with people who might be driving in the car right now, listening to this audio, who have said things to me, such as, and I'm not quoting anyone, but, Doc and Eva, you guys aren't addicts, so it's not as easy as it seems to pluck me from my family, pluck me from my job, stop everything that's going on in my life. I've got other things that are going on right now in addition to my addiction. I've got a house to take care of. I've got a roof to put on before the winter. I've got big, important things. I don't have time to be completely removed from my life, from my kids, whatever it may be. My job, my income, to be put over on this safe harbor. It just doesn't work for me. But that's like maybe the most difficult part is slamming the brakes on to everything.
Yeah, I think you're describing a person that has a modest amount of resources, and in my experience, those folks are actually easier to work with because the person you're describing has made a decision, is motivated, and is saying, I want to make a change. And once they've gotten over that threshold, there's lots of ways to work and make the programs work for you.
You got to get over that threshold first.
But you need to get over that threshold, and if you're not in a place where you can without stress, without burdens upon you, think through that and get to that point with some support, it often falls apart. One of the points you made is a really good one, and it has to do with stigma and misunderstanding, and that is people are often really dismissive of the recovery efforts because they see people return to use. And they say, see, people, you're an addict, you're always an addict.
We've talked about this so much on this podcast.
And, there's very clear data that shows that, it's a tough road. And on average, we just saw a presentation last week by a recovery specialist from
leading
Boston,
researchers. Mm-hmm.
A leading researcher on recovery. And he presented this fantastic diagram, this graph of typical recovery, and it's over years, and it's over 10 instances where people return to use before they really stick. It sticks. Recovery sticks. And once again, that's no different from a diabetic or somebody who has chronic obstructive pulmonary disease from smoking and keeps trying to stop smoking, or the person who is at risk for a heart attack and just is struggling to increase their conditioning and fitness.
Or someone who's trying to stay away from the casino, but every now and then finds themselves sneaking in.
Right. Yeah.
Yeah.
So it's no different. So if we can help educate, if we can get that diagram in front of people and say, just understand this and compare it to other things,
sure,
you may be less intolerant, less dismissive of this person's efforts and our efforts working with them, and maybe join in with their recovery.
Sure. If you're just joining us, the program director of the Central Vermont Prevention Coalition, Central Vermont Medical Center, emergency room physician, Dr. Mark Detman, and the new head of this program, Eva Zaret. $1 million is coming into Central Vermont. And you said earlier, seems like a lot of money, but we have a huge task here. I mean, this is tall order.
Yeah.
We do, yeah. And I think what's really unique about the way that we're addressing this issue is that we see it as a system. And so you can't just funnel the money into one part of the system.
No
it has
way.
to all work together. And so what's really, what's amazing about this coalition is that it's the glue that's holding all of the pieces together and helping them all work together.
Yeah, EMS. Let's talk about it. EMS, police, mental health, housing. These are all things that are related.
They're all integral to it. And a great example of coming together is the recovery housing that's going to be opening here in Barrie soon for women with children who are trying to safely recover and be in a safe space that's supported. That's really exciting, and that wouldn't have happened without the cooperation of Down Street Housing and other community partners, as well as recovery organizations, recovery location organizations around the state that have come together to do this. It's a very vulnerable population, and we want kids to be raised in as healthy environment as we can get them, and so we want their moms to be healthy.
Yeah.
It connects to one of the projects that's dear to our hearts right now, and that is we're trying to help women who are using and are in treatment and or in recovery who are pregnant. And we want to try to make their lives simpler and keep them as healthy as possible during that pregnancy and in the highly vulnerable first postpartum year when life is really stressful with a young child, and dealing with your addiction that's hopefully under control. We're trying to get CVMCs working with multiple agencies in our coalition to pull together a facility, a treatment place under one roof where the medication-assisted treatment, the buprenorphine, can be managed by the team at the same time as the obstetric care and even potentially the pediatric care during the postpartum year, all can happen under one roof, and where these women can be supported with their lactation counseling before birth and what to expect around the birth with your baby who may be challenged because of your substance use, and what that first year is going to look like, and how we're going to help you with some nutritional education and other supports that we can give you, all under one roof, make their lives a lot simpler because these women are busy women.
Yeah.
And if we
Central Vermont Home Health and Hospice is really dialed into this,
and
too.
they're going to be a partner in this project.
Yeah.
And so once again, in Vermont, this sort of clinic only exists in Burlington. There's one down at Dartmouth, but it's a bigger challenge to develop these at community hospitals in smaller communities where the resources aren't quite as rich. There isn't an academic research arm that's helping to pull in dollars to do these programs, but it just makes sense for this population, which is not all that big, so we should be able to do it. And
Sure.
CVMC is fully behind making this happen.
Sure.
And I think that's what gives our coalition some of its potency, is that we have a fully committed hospital system behind a lot of these efforts, being led by an administration that believes in the mission of improving the population of our people. And this is the sort of thing, who are the most vulnerable people? And these are some of them that we're working with and serving in our work.
Eva?
Well, the other thing that we just haven't really talked about yet that we should is that the title of the grant that we received from the federal government, what they call it is a Rural Community Opioid Response Program grant. So rural. And technically, by government definition, Barrie and Montpelier are rural. But we're really focused on how do we reach people in Woodbury or in Orange, or the rural places that often are left out of the conversation.
Oh yeah,
the W's: Williamstown.
They're all W's for some reason.
Warren,
West Thompson,
Waterbury.
Yeah.
Yep.
And we're actually, we're looking for suggestions from your listeners as to how we can get this to people. I mean, COVID's going to be with us for another year. How do we do it during COVID? Would people over in the Mad River Valley be interested in getting onto a Zoom meeting that we organize that they could just listen in on? We can have a lot of our partners there and just ask questions and talk about things you don't really understand or you'd like to understand better. How do we get help? Who do we call? What do you think about this? Could I do that? We're just looking, because it's harder and harder to do these things in public nowadays, in person. So between select boards and schools and other virtual means, we would really like to hear how we can best reach out and touch people that are interested.
And we can't lump Central Vermont together as one unit all the time. Every place is different. Plainfield is very different from Hardwick and so on. So it's really important for us to talk to each town and village and understand what they need. What they need in their community, how does it align with what we are doing already and what we can help provide.
I just tagged the link for your Facebook page right here in the comments section for folks to be able to get in touch with you. Not just get in touch, but stay in touch. Doctor, I'm sitting here, I'm looking across at you into your eyes, and I'm thinking to myself, your two eyes have seen things that I never have. At 50 years old, I have never seen anyone overdose. I've seen someone drunk, but I've never seen someone overdose. Not sure what that looks like. I want to ask you both if members of our community, if you feel personally that we should be carrying around Narcan, and we'll get to that. But is there one day that goes by where we don't see an overdose just at Central Vermont Medical Center emergency room?
Absolutely. Drug overdoses are not fatal drug overdoses are nowhere near a daily occurrence in Central Vermont, and thank God for that. I mean, I think there's actually a remarkable amount of awareness and concern about this issue. And
I have the numbers. So in the first 4 months of 2021, there were 9.
She's the data queen. Well, she's the data team leader for this 4 kids out of Virginia. So, I mean, she's...
The numbers are important to me. The numbers are important because it can become something else in your head.
Yeah.
And you need to know exactly what it was. So in the first 4 months of 2021, there were 9 fatal opioid-related overdoses in Central Vermont. Okay. In Washington County.
Washington County. Okay. Okay. What does that... What?
And some of them don't come to the ER, so I personally don't see them all, but we know the numbers.
Those were fatal, and there were about...
People see them here in Barrie on the street, so...
Yeah. I'm sure it's just a matter of time for me, and I feel somewhat kind of blessed that I haven't seen that. But That's really startling to me.
Yeah, but those numbers are a tragedy, and I think anybody, we would just like people to understand that if you have any concerns that people that you touch or are near you or you love are engaging in risky behavior, you should have Narcan somewhere available to you. You should know how to use it, and you should let that person know you have it, and let them know that you really want them to be as safe as possible, and that's why you have it.
Should everyone be walking around with Narcan?
I don't think everyone should be walking with Narcan.
Okay.
It's not.
Is it the answer? Is it? I mean, I think we all agree it's not the answer. It's the answer for some things. It's the answer for saving a life. Or trying to save a life quickly.
Is. Absolutely is. If you think you may have the opportunity to save a life, and plenty of people do. I mean, I think there's a role for people in schools to have these things. I think people, family members who have concerns, who maybe, who know that someone is at risk in their environment. Certainly, first responders need to have it, and they do, because of the good work of some of our partners in our state.
So much controversy around it, though. Is
there? I guess we're sort of removed. To me, it's an extremely safe and effective medicine.
But it's about the stigma. It's about
of course.
These are personal decisions people make.
Yes.
I just think you get the science out there and you say, if you can prevent someone dying, and the key though is you got to marry that to prevent them from dying, but get them help. And this is the key to me. When someone overdoses in the street and they're revived, you want to have them touch someone that they can connect with right away, because ideally they're going to be withdrawing right there on the street.
Yes,
because you just reverse their opioid receptors.
Sure.
And they're going to be withdrawing, and they're going to want to skedaddle from the scene as fast as possible. Mm-hmm. So in some states, they're actually empowering first responders to start that person on buprenorphine, to immediately settle those opioid receptors, get them settled down so we can talk, and maybe we can talk about a path to recovery for you, instead of having you, jonesing out right now and just wanting to get away from here as soon as possible.
If someone were to bring a family member or a stranger or someone, let's say they were administered Narcan and they're alive, bring them to CVMC. We walk through the doors. Is the staff there already? Is their mindset already engaged with the Central Vermont Prevention Coalition to go right into action immediately? We know what road we're going down here immediately.
Yeah, we do. And this is a program, this is one of those steps that we've made in the last 8 years or so that I think is really extraordinary, where the whole staff have recognized that this is a public health crisis, but it's medicine, and we're just practicing medicine. We're practicing the best medicine, and this is the care we would be delivering to anybody who comes in here with a heart attack or a blood clot in their lung or an infected leg or a traumatic injury. This is just normal medicine for a medical condition. And so the team is there's a team that wraps around these folks, and that team is not only the doctors and the nurses and the PAs, but it's also the social workers, it's the peer recovery coaches, and there's a protocolized, there's a protocol that we follow to engage that person, to gauge their motivation to make a change now after this experience, and actually be able to link them to services, get them started on a substitution medication that's a lot safer.
Yeah.
And hopefully
get them stabilized.
This is the first stabilization towards recovery. It may not be the last, but we're going to help you, just like we would give somebody insulin for their diabetic crisis, or we would give somebody nitroglycerin for their coronary crisis. We have to erase those barriers that this is different care. This is standard medical care now.
What about the police? What about the justice system, treatment court, that whole avenue?
Yeah, once again, we live in a remarkably forward-thinking and thoughtful state where, and in this county, the treatment court here is a really great example of a well-functioning place where you can divert people from the criminal justice system to treatment as an alternative for those that are motivated to do so, and that system works really well. And we're partners with, say, the justice centers in Barry and Montpelier, where people are coming out of incarceration, many of whom have substance use disorders.
Yes,
and they're laser focused on helping those people stabilize their reentry into the community, engage in treatment, stay engaged in treatment, and it's a challenge because, life is tough for that subset of people. Their lives are really challenging.
Yeah, I mean, look at Working Fields. They've got a satellite office just down the road here in Barry. They're doing great things.
Yeah.
Huge things.
Yeah.
It's so important for your employer to be supportive. If you need to take that time off from work, like you were talking about, how do you step away from?
Amen.
It's so important.
Amen.
And that's part of the education of the reducing the stigma and the misunderstanding, is that employers understand that, we've medicalized in a lot of ways the normative care of people with this disorder. And as much as they would not tell someone, we're not going to continue employment here if you're in a drug treatment program, they wouldn't say that to somebody who's being medically treated for any other conditions. So
epilepsy or whatever it may be.
Exactly. And there are risks to that. People can have a breakthrough seizure at work, but no one's going to say we're not going to take that risk.
Right.
Because it's just not, it doesn't make any sense.
Sure.
And so, anything we can do to help change that culture with our information and our partners, we want to be engaged in.
Eva Zaret is heading up along with Dr. Mark Detman from the Central Vermont Hospital, this amazing new program. Central Vermont recently saw the award of this 3-year federal rural communities opioid response program called Building Safe Harbor, right here in Central Vermont. And the Central Vermont Medical Center is, you guys are the big players. And we've got some amazing members of our community who have partnered up and said, we want to get involved, we want to be part of this. But you're also looking for more grassroots.
Yes.
You're looking for people in our community that live it, breathe it, see it, taste it.
That's exactly right.
Very intimately engaged with the issues that we're having in Central Vermont.
And I think part of that, if I can go back to something you said earlier, which is that, Mark and I are seeing this from one perspective, but we may not be living it. Although you don't know that, but
That's true.
You can't make assumptions about people. But we do have a different perspective, and it's so important for the voices of people who are being affected to be guiding the work and the decisions that we're making. And part of that is by reaching out into the small rural towns and saying, what do you need, and have your voice be heard, as well as the people who are in treatment and recovery and actively using substances.
Sure. We know that you were both an integral part of our recent community forum that we had here in Barry City with the Vermont Council on Rural Development. That was a dare I say, one of the biggest, if not the biggest, issues that was part of that.
That was raised by the town, the city.
Yep.
I know that Senator Patrick Leahy is a big supporter of the Central Vermont Prevention Coalition. Are you getting a good response from the Vermont legislature?
Our congressional delegation has been fantastic. I mean, they really are.
They're on board.
They're not only on board, but they're incredibly proactive and supportive and incredibly aware.
They are.
Senator Leahy and Senator Sanders' office, they really know what's going on. They're really, not only are they interested, but they're active advocates and supporters of trying to find solutions for the problems that we're all identifying here.
Do we have a short-term goal? I think we all know what the long-term goal is here for the Central Vermont Prevention Coalition. But what's the short term? Is it just to be in the media like this to get the word out that this is what's happening and this is who we are and this is what we're going to be doing? Is that like the immediate goal here?
Yeah, it really is.
Yeah.
It's to reach out, have people hear us, know where the resources are, to understand the nature of the problem and the solutions to the problem, and to try to prevent the problem from starting for more and more people, just so that it just doesn't even become an issue anymore. Right. Our long-term goal is of course to reduce death and disease associated with harmful substance uses. But in the meantime, we have lots of projects that touch on things that we can do right now that will help people across the board and in their different sort of subpopulations. And we're going at them. I just want to get back to Eva mentioned the voices of people that have had these life experiences or who are experiencing them now. We're going to be setting up a small advisory board of folks like this, but the board needs to have ways to reach people across the board. We're looking for people that are, how do you get someone who's actively using drugs to actually participate in a conversation, to assess where they are, how they got to where they are, what they see in their future, and what the community can do to help them if they want help, or looking at their own lives and reflecting on what could have happened differently in their lives to maybe have them put them in a different place now. People who are in treatment now, people that have recovered from alcohol and drug use, we'd like to hear their frank thoughts on the path that got them where they got to, and how we can all work together to potentially make that not be a repeated experience for other people. So we're going to be working on that. That's a short-term goal, and it's going to be exciting to try to find folks that'll help us with that.
And I think another long-term goal, besides just reducing morbidity and mortality or death and disease, is we want to change the whole culture of how we address this issue in central Vermont.
Amen.
And I'm talking years. That's years of work. And that's something that people can look at and say, ugh, but that will take so long.
Yeah.
But there's this quote by Earl Nightingale that I always come back to all the time in this work, which is, if I'm paraphrasing, is that the time is going to pass anyway. So we may as well put it to good use.
Yeah. Hope is it seems like most of us have hope. Some of us have some discouragement with this whole thing. But maybe hope is winning.
It is.
Yeah, I think so.
I really
do.
Is.
We see so many wonderful projects underway and people that are truly enthused about it. And once again, I'm going to give a shout out. I think this is National Recovery Month.
Yes.
Mm-hmm.
But the work that we're seeing that the peer recovery coaches are stepping up to start to do is phenomenal, because I can talk to somebody in the ER who's come in a mental health or a substance use crisis, but I'm busy. I'm darting around. I can't sit down and really get into their heads and their lives, whereas a peer recovery coach can, and they do.
Yeah.
And they do it from a place of having been there.
Yes.
Which is so incredibly powerful. I can't say it enough.
Yeah.
This is a workforce that
24/7.
This workforce needs to get built into the payment model for this care. They need to get livable wages. They need benefits.
Yeah.
Because this is real work.
Of course.
This is stressful work.
Sure.
And the beauty of a person like Hillary Denton, who is supervising the peer recovery coaches in the ER.
And recent one of the 5 first Recovery Vermont All-Stars named yesterday.
Yeah.
She won that.
I saw that. I saw that somewhere.
Yeah, but the magic that she has is she understands that this is really stressful work, and is putting peer recovery coaches into a hospital setting, to an ER, into inpatient units where they're tracking a patient that's been admitted, And she needs to build a team that's healthy and coherent and knows how to talk to one another, knows how to share the stressors, share their best practices with one another, and really stay healthy themselves. And I can't say how fantastic that is, that work's being done.
Yeah.
But we need to support them
Sure.
in ways that they're outside of the healthcare system.
Sure.
Right now.
And I have to just say this because I'm going to forget. Kudos to the ER staff up there. I mean, you guys are angels.
Yeah, well,
I'm
just going to tell you, we're just starting on a program that's laser focused on alcohol dependence. And we're really hoping in a sort of pilot way to show that it's a tougher addiction. It's a tougher, longer term addiction. There's more social acceptance in a lot of ways of chronic alcoholism, which is just tragic, but it's a tough recovery. And we really want to try to build the equivalent of what we have with the hub and spoke model for opioid use disorder. We'd like to build that here with a specialty clinic and then spokes of primary care where that long haul can be managed within the healthcare system with very clear evidence-based strategies that involve maybe some medication help, definitely counseling and therapy, identifying root causes of trauma that can be worked with, maybe bringing loved ones and spouses in to work together to help the healing process. But we're going to be launching that soon, and you'll be hearing more about that. But it's once again, you asked me if I see a drug overdose every day. No, I don't. But I see an alcohol use crisis every day.
Will you come back in here and give us an update on that?
We will.
Please.
Yeah.
We want to get involved here at Air It Out. Raylene is extremely passionate about this. We want to partner up with you guys. We want to be the voice for the Central Vermont Prevention Coalition, if we can, locally, right here. We're right on North Main Street. It would be an honor to do that. Before we sneak out of here, you say many partners, one mission. Let's throw some love at some of these partners before we wrap up. Vermont Cares, the Central Vermont New Directions Coalition, Washington County Mental Health, Barrie Community Justice Center, the Phoenix, Gifford Health Care, the Turning Point of Central Vermont. What is this now?
BART Programs is also Central Vermont Addiction Medicine. That's the hub in the hub and spoke for treatment.
Wow!
Right.
Look at how this is a gargantuan umbrella that you guys are. The Central Vermont, the City of Montpelier Police Department, Vermont Center for Crime Victim Services, and the list.
Yeah, the Montpelier Justice Center. Who else?
The list goes on and on. Yeah. Washington County Youth Services Bureau. Yeah. Of course, the Department of Health for Vermont.
The Department of Health in the states, they're just overwhelmed by COVID for the last 2 years,
yes.
And yet their ongoing steady cadence of support for the work we're doing is just huge and fantastic. Mayors Watson and Herring have been incredibly open to hearing what we're doing and being mouthpieces for our work. We're going to be speaking at the
Barrie City Council soon.
Coming up soon. We really want to talk to what we're hoping to talk to them a bit about is some of this youth risk behavior that Eva's done an amazing job of taking the schools' data on youth risk behavior, the surveys that they've done, the most recent one, and sort of turning it around and looking at it upside down and making some really compelling connections between behaviors that can be promoted in schools and families that can actually impact a lot of mental health and substance use outcomes.
And that's really how we feel things like going on this podcast can help us, because somebody might hear something and say, I can help you talk to the right people.
Yeah. And promote the message of to our youth of get addicted. Get addicted to things like music and sports and boating and fishing and hunting or whatever it may be. Find a niche and get hooked on it. As long as it's something that's
nice. I like that. Hey, I like that.
Something that's healthy for you.
Exactly.
That you can carry on through your whole life.
Yep.
371-4875. We're going to post that, but that's kind of a number to get help. cvmc.org/treatment help.
You can also dial 211.
Yeah.
Which is probably easier as 3 digits. And Vermont HelpLink is a statewide resource to find treatment and harm reduction help.
So it's a VT Help Link.
Okay. This has been wonderful. These conversations, we need to have them more often.
Yeah. Thank you for opening the door to downtown Barrie and to your audience.
Well, thanks to Raylene for finding all of this out. She's always clicking away, click, click, click every night, finding stuff, and she just blew up my phone one night. Central Vermont Prevention Coalition. We're gonna get them on. So there's excitement in that that we've discovered each other. We're going to get some more information on the comment section here about this. But God bless you both for what you're doing.
Well, thank you.
You have a lot of work to do, and I know you got some team members, but you both say that the most important members of your team to be able to start chipping away at this are the community members. Mm-hmm. They've got to be engaged with you. They've got to be involved.
Yes.
Yeah.
So important. Thank you both for getting in here.
Thank you so much.
We'll do it again soon. We'll
do it again soon. Thanks.
Dr. Mark Detman, who is an emergency room physician at Central Vermont Medical Center, and Eva Zaret, heading up this $1 million treatment project, which is so important. Building Safe Harbor in Central Vermont, part of the Central Vermont Prevention Coalition. And this is just the beginning of what you're going to be hearing us talking about here on this podcast. Our presenting sponsors, the Central Vermont Chamber of Commerce, Barrie Area Development, FGB Theaters, RetirementVT.com, Aeromed Essentials, Vermont Custom Woodworking, the Barrie Montpelier Times-Argus, Donnybrook Fight Promotion, Wright Electric, Fontaine Forestry and Millwork, Gauthier's Quality Grounds and Maintenance, K&W Tire, Emsley's Florists and Gifts, Granite City MMA, and Barslow Construction. We're going to be back in just a little bit with yet another show in just a few minutes from right now here on Aired Out.